So on the show today, we're joined by Evan Blake, who writes for the World Socialist website and whose most recent article is entitled Historic Significance of Trump's Fascist Assault on Science. He explored the extensive repealing of public health protections and dismantling of scientific inquiry and research. And of course, this is happening while we've just come out of a global pandemic with COVID-19, bird flu's ravaging the poultry population in the US, Texas has a measles outbreak, and at a time, of course, climate change with all that involves. So welcome to the show this morning, Evan. I wanted to ask you, how are you defining fascism here? In that, are we fully in fascism? Is this a fascist regime or the beginnings of it? And what are the characteristics? And how is an American fascism different from, say, what took place in Germany, what took place in Italy, what took place in Yugoslavia, what took place in Spain?
Yeah, well, that's a very complex question. But first of all, thank you very much for having me on the show today, Rebecca. I really appreciate it. And I just, as a initial response, I would say, we really encourage our listeners to read and study what we've been writing on the World Socialist website, where, we've really been drawing out every day, in particular on our perspectives statements, the fascist character of the policies that the Trump administration is seeking to implement. And for those that aren't aware, the World Socialist website is the publication of the International Committee of the Fourth International, which is the World Trotskyist movement. And we base ourselves off of the historical legacy, in particular of, the entire Marxist movement, but the work that was done by Leon Trotsky in the struggle against Stalinism. And one of the really defining events of the development of the Trotskyist movement, and what Trotsky wrote about really centrally over the course of the 1930s, was this very question of the rise of fascism, in particular in Germany, but also throughout Europe. And in Trotsky's analysis, he defined fascism as really a mass movement rooted in the petty bourgeoisie, which was supported by big capital, the big bourgeoisie, with the aim of crushing the working class and really preparing the grounds for the most ruthless and barbaric exploitation of the working class, really a complete counter-revolution. And he stressed that the ruling class turns to fascism under periods of really intense social crisis, when they can no longer maintain control and stability through democratic means. And I think that's, these elements are really evident in the situation today. The American ruling class is, confronting a massive economic crisis, social crisis, and political crisis for which they have no solution. And sections of the ruling class are very openly turning towards fascism and seeking to create a dictatorship in this country. And so we've seen it very clearly with all of the executive orders that Trump has implemented, what you were just referencing, the mass deportation of immigrants, and really the tearing up of all of the core democratic rights in the American Constitution, and the social rights, which have been won by the working class in over a century of struggle. And I think, in addition to the what you're just referencing, the deportation of hundreds of Venezuelan migrants to El Salvador, with absolutely no recourse. We've also seen the mass arrest of students, the targeting of Mahmoud Khalil, which they just, this last week, Rubio made very clear that this was on the basis of essentially thought crimes, which was a concept developed by the Nazis. And so in the article that I wrote on Trump's, we called it the historic significance of Trump's fascist assault on science. We tried to sort of apply this framework to the massive and unprecedented attacks that Trump and his henchman, Bobby Kennedy, are carrying out in regards to science and public health. One sort of really critical difference, which we have emphasized between the rise of fascism in the 1930s in Europe and also in other countries, Chile, and other countries throughout the world. One of the key differences today, or sort of a central feature of the rise of fascism in those historic cases, was really the defeated character of the working class. There were a series of massive defeats that the working class suffered in the course of the 1920s, and really betrayals which had been carried out by their leaderships, in particular in Germany, the KPD, the Communist Party, and the SPD refused to carry out a united front to prevent the rise of fascism, and really facilitated the rise of Hitler. And I think, the situation today in the U.S. is different. There is, a growing radicalization and opposition to really the entire political system and social system. And I think that's found, somewhat distorted expression in the mass turnouts for the Sanders and AOC rallies. We have fundamental differences with both of them, but it is objectively very significant that 36,000 people came out in Los Angeles, 20,000 in Utah, a historically conservative state, and other states throughout the country. And we also last week, just over a week ago, saw millions of people take to the streets to protest the Trump administration and the Democratic Party. And so I think that's sort of a key difference which has to be emphasized, is that really the American working class and the international working class are not entering this situation from a position of historic defeats, but really of a growing radicalization and a determination to struggle.
Right. It's a very, very good point. And I understand there's another march and rally in the offing. And certainly there'll be some protests on April the 15th, tax-paying day, because of how our taxes are being used to commit genocide in Palestine. So I just wanted to turn back to your article that you argue that the Trump administration are social vandals, and their elimination of programs domestically and internationally threaten to reduce the working class to slavery. How do you see cuts to science making that happen?
Right. Well, there's a number of ways. I think, one of the sort of principles of Marxism is that social consciousness lags behind being. And I think there is not sort of a full recognition or understanding of the scale of the attacks which have taken place. I think a lot of people have been following these broader attacks on democratic rights, but in terms of the attacks on science, what they have done, or what they did in particular on April 1st, what Kennedy referred to as a revolution, amounted to a total counter-revolution, really gutting all of the core public health agencies which exist in the United States. They fired over 10,000 people, in addition to over 10,000 sort of reduction in force, layoffs. And so that collectively, so far, they've eliminated roughly a quarter of all federal public health workers' positions. And this, includes dozens of agencies where, they've basically destroyed the majority of their functioning, including the critically NIOSH, the National Institute for Occupational Safety and Health. Over 80% of the employees were fired there. NIOSH is responsible for maintaining mining safety, monitoring chemical exposure, testing the masks that workers and everyone uses to protect themselves from harmful materials, including viruses like COVID-19. So that was one agency. They also eliminated the Chronic Disease Prevention Agency, the HIV Prevention Division, many others, many that were targeting or sort of apply specifically to workplaces. There's one, the National Center for Injury Prevention and Control, and just many others. And so I think, those...
Well, that one monitors, disbands and ends firearm mortality tracking, right?
I think it also...
the National Center,
I think it's also just related to just injury prevention more broadly.
Right.
But anyway, all of these are very much bound up with, directly attacking the working class, NIOSH in particular, undermining workplace safety, workplace protections. They also, since these cuts took place, they announced the ending of a program that the CDC had to basically screen cruise ships for outbreaks of norovirus and infectious diseases, and so it's all down the line. As we said, they're trying to essentially turn back the clock on history and return the working class to the conditions of sort of industrial slavery under in the beginning of the Industrial Revolution or earlier, and really destroy all of the key gains won through scientific discovery, going back to the Enlightenment. And so you have a figure like Kennedy promoting quack science and totally debunked claims about links between vaccines and autism, and so I guess that's an initial response. There's a lot more that could be said. I did want to highlight another cut which they carried out, were essentially all of the agencies overseeing the response to bird flu, which you referenced at the beginning, and so already the response to bird flu, going back to the Biden administration, has been totally criminal. They've basically allowed this virus to spread. We've written about this extensively on the WSWS, but they have done the absolute bare minimum in terms of responding to this really existential threat of a virus which historically has a 50% fatality rate. But now, under Trump and Kennedy, they were completely flying blind. And they're working with Brooke Rollins, the head of the USDA, to just completely dismantle the surveillance for this really pressing danger, and that basically increasing the likelihood of another pandemic.
And you also said that the hiring of Jay Bhattacharya for the NIH. His take on things was that herd immunity. Immunity was the best thing to do. So we're going to get all the chickens together and just sort of they'll all figure it out, right?
I mean, yes, that's basically the approach that both Brooke Rollins and Kennedy have floated this possibility of, instead of culling infected herds among poultry farms, they've both publicly stated that they're open to letting bird flu just rip through poultry farms, which is obviously insane on the face of it, and it's been widely denounced by scientists. It would, basically give the virus millions of hosts in which it could evolve and, cause like the horrific death of tens of millions, suffering of, tens of millions of poultry across the country. But they're seriously considering that. And actually, for all we know, at this point, they had talked about piloting that on certain farms. And given that they've destroyed these agencies overseeing the response to bird flu, for all we know, that could have already started, and we would have no idea.
And then I have to ask the question: the concern beyond that is that then this virus can then replicate to then what? Break the blood barrier and end up in the human population? This is a possibility.
Yeah. There was a study which was done recently in Southern California. I forget which institute it was, but they basically determined that the virus only requires a single mutation. I can't remember the exact one, but if through the evolutionary process it acquires this mutation, they hypothesized basically that it would be capable of spreading from human to human. So that, that's a very, real possibility. And, so far, the cases among humans have been a variant that's less lethal. So just in the past year or last year, I believe the U.S. had over 70 official bird flu cases, which historically was the second highest figure for any country in the world. We've known about bird flu I believe since 2003, and it's been really one of the sort of foremost dangers, which experts and scientists have been warning about for decades now. But last year, due to the policies of the Biden administration, the U.S. had the second highest number of official infections. The real figure is likely in the hundreds, again, because they really provided essentially no protections for the farm workers at dairy farms and poultry farms, who are, in many cases, immigrant workers, fearful of deportation. And so there's been many cases that have gone under the radar, and each infection from cattle to human really increases the risk of human to human transmission.
Yeah.
So it is a very real, or sort of a real and growing danger.
Mm. In your article, you mention how America became the global center for scientific research and innovation after World War II. How did that happen, and what were some of the landmark discoveries?
Yeah, well, we go into this in the article a bit, but really, it was it's sort of an interesting history, and there's many films on this. The film Oppenheimer from a couple years ago, I think, gave a glimpse into some of these processes, but really, and there are many other films as well, Copenhagen, but they're, the rise of fascism in Germany and across Europe really, as we note in the article, facilitated a brain drain of the most talented scientists, Albert Einstein, Enrico Fermi. There's others, many others, in particular physicists who were targeted by the Nazis, who spoke about Jewish physics and Jewish science, and this led to a mass exodus among a significant layer of the European intelligentsia, many of whom sought refuge in the United States. It was a contradictory phenomenon, but the U.S. was at that time still viewed as the sort of center for democratic rights, and it was very contradictory. Obviously, that you had FDR, imposing the Alien Enemies Act, and carrying out the mass imprisonment of Japanese Americans, the internment, orders. But still, the U.S. was the dominant imperialist power, and in particular over the course of World War II, but in particular coming out of the war, there was this effort and sort of a recognition by the American ruling class that their interests would be served, and that industry would be able to develop more rapidly if there were sort of a synergistic relationship between the federal government and academia. And so you saw, the establishment of the National Endowment for the Sciences, for the Arts, etc., and really the beginnings of this, the modern day health and human services agencies, the 13 sub-agencies, which today are part of that. And it led to a whole series of innovations. We pointed to some of the most significant in the article, including the development of mass production techniques for penicillin, the vaccines to prevent polio, HPV, and other pathogens, treatments and therapies for HIV/AIDS, breast cancer, the entire green revolution. Much of that was developed in American universities. Later on, the Human Genome Project, and then really, the whole development of Silicon Valley and the computer technology revolution and the communications revolution of the 80s and 90s. But in particular, in the field of sort of health sciences, the U.S. was really the global epicenter for this research. And we can go into it more, but this began to, and at the same time, you saw, in places like California and other states, the sort of gradual expansion of access to higher education. As we say in the article, it was never universal. There was always, significant sections of the working class that were, denied the right to higher education, but in general became more accessible, and you saw, just a significant growth in sort of access to higher education. But really, the election of Reagan and the growth of financialization saw sort of the beginning of a gradual decline in these processes and sort of a turn. And by the turn of the 21st century, really, the sort of dominance of American academia was beginning to be supplanted by China in particular. This is only accelerated since then until now, where, in response to these attacks, just in the past 3 months, under Trump and Kennedy, we're seeing the beginnings of a new brain drain. And I think, the parallels with, 1930s Germany are quite striking. The fact that there's a poll which we cite in the article, which found that 75% of scientists in the U.S. are considering leaving the country because the conditions are getting so bad so rapidly. So I know I've said a lot, but it's a very...
And they're thinking of going back to Europe, right? Or going to Europe.
Yeah. Europe or Canada. I know Canada is a major place that people are considering going to.
Yes. So if we're looking at cuts to personnel and departments like Epidemic Intelligence Service, the World Health Organization, pulling out of the World Health Organization, cuts to NASA's work, NOAA, why do these things matter? I mean, what's lost when this happens?
Well, a great deal. I think, the entire sort of future and development of science and technology are sort of hanging in the balance. I think, the pulling out of the WHO is immensely significant. Essentially, the CDC, the NIH, all of these agencies, which, for decades were seen as the sort of the what's the term? Just the, you know, the standard bearer for public health and for science, sort of led the way internationally for, for countries throughout the world. And now, the U.S. is, these agencies can no longer collaborate with the WHO. They, for example, say the bird flu situation develops and, Brooke Rollins and Kennedy begin doing this insane experiment on a poultry farm in the U.S. And you have, 1 million birds with bird flu, and it picks up that one variant and develops the capacity for human-to-human transmission and begins spreading in, whatever town or city is closest to that poultry farm. Within days, it could be spreading, throughout the country and internationally. And throughout that time period, countries throughout the world would be completely left in the dark. And so, so that's one example, but the reverse process is true as well. The U.S. has long been one of the major funders for the WHO, and by cutting off ties, it's hindering the ability of scientists to track the next pandemic. And I think also just an important element, which I wanted to make, is that a lot of the entire sort of precedent for this. Before I get to that point, just another critical example is the PEPFAR program. I can't remember what the acronym stands for exactly, but essentially this is the program based in the U.S. Which provides the vast majority of treatment and medication for HIV/AIDS patients in low-income countries. And there have been estimates that really tens of millions of people throughout the world will now be denied access to these treatments. And so, just a very concrete and immediate impact of these cuts is literally the lives of millions of people are now at risk. And just all down the line, there's sort of similar sort of vast ramifications for global health. And in the article, we make the point that, the scientific advances which were made through this collaboration between the U.S. federal government and academia, basically collectively saved, millions of lives throughout the world and extended life for, the vast majority of the world's population. And now all of that is basically being clawed back. But just the point I wanted to make was really the what led to this situation and really what paved the way for Trump and Kennedy to carry out this complete dismantling of public health was really the response of the Biden administration to the COVID-19 pandemic, which I do want to stress is it is ongoing. There's been a massive effort by the corporate media and both capitalist parties, the Democrats and Republicans, to claim that the pandemic is over. But I really encourage everyone to read our material. In particular, we've been doing a series on the 5-year anniversary of the start of the pandemic, where we've drawn a balance sheet of where we are. But there are ongoing deaths from COVID-19. We cited one recent estimate where they're based on estimates of wastewater. There's not continue to be roughly 400,000 COVID-19 infections in the U.S. every day. This results in over 140,000 new cases of long COVID every day. At this point, over 20 million Americans are suffering from long COVID. And every week, there's somewhere from 1 to 2,000 excess deaths just in the U.S. And if you extrapolate that globally, that's over 20,000 people who continue to die, from COVID-19 or associated, long-term damage caused by the virus throughout the world. And really, what the Biden administration did was completely normalize this criminal policy of sort of unending mass infection and debilitation with long COVID. And, it part of that was, or really central to that, was undermining many of the core concepts of public health. So I could go into that further if you want, but we've written a lot on the WSWS about it.
Evan, I'd like to have you back on that. It's a whole other area. We should talk about it, but I'm running out of time this morning.
Okay.
That was incredible. Thank you very much. That was Evan Blake, who writes for the World Socialist website, whose most recent article is The Historic Significance of Trump's Fascist Assault on Science. Really worth a read to watch the sort of transition that's underway and get just the list of all the things that have been, all the departments that have been cut. It's a shocking list. Thank you for joining me this morning, Blake. And I must have you back on the show.